Pleasure. So, hello everyone. Today we are going to discuss about gallbladder stones, decoding everything, and about the surgery as well. So, why gallbladder stones happen? This is the most important thing we need to understand the pathophysiology of gallbladder stones. So, here comes the bile. Most important thing is here bile. What is bile? Bile is not just for digestion of fat. We know that bile helps in digestion of fat, but it is not that. Bile helps in digestion of fat. It acts as a excretory material. It acts as a you can say that bile helps in like what you say. Uh, it helps in it acts as a missile through which what happens is, say for example, it is there is a detergent. What does that detergent do? It frees it reduces the friction. Okay, that freeness, that low friction is delivered through bile between the nutrient materials. So bile salt, what does bile contain? Bile salts, phospholipids, cholesterol, bilirubin, water, and electrolytes. So these are the most important things which are present in the bile. Now coming to bile remains as liquid only when cholesterol is kept soluble by bile salts. So how does bile salts helps? Bile salts helps in keeping the cholesterol in soluble state. So whenever the bile salts number decreases, the solubility of cholesterol increases. That means the cholesterol solubility will not be happen, and there will be like saturated cholesterol crystals, which leads to gallstone formation. So now liver produces bile, gallbladder concentrates bile. Then what happens whenever we eat fatty food or something like that, processed foods, fatty food, then cystokinase enzyme will activate, cholecystokinase. This enzyme will help in gallbladder contraction. So this gallbladder contraction helps in. Now what happens? The bile which is present in the gallbladder, it enters the intestine. Now bile salts are reabsorbed. In the bile, there are bile salts, right? Those bile salts are reabsorbed in terminal ileum. Then again from the terminal ileum, they will enter the liver. This is a cycle. So whenever there is disturbance in this cycle, then definitely there will be high chances of formation of gallstones. So gallstones form when there is imbalance. This when there is no balance between this cycle. So there are three critical pathological mechanisms. One is cholesterol supersaturation. So excess cholesterol secretion, reduced bile salts or phospholipids. One is excess cholesterol secretion. Second is there will be reduced bile salts or phospholipids. Then there will be formation of cholesterol supersaturation. Now coming to what are the causes of excess cholesterol secretion and reduced bile salts? One may be obesity, rapid weight loss, or estrogen, or insulin resistance, or non-alcoholic fatty liver disease. These are the different causes of excess cholesterol secretion or reduced bile salts or phospholipids. So what happens now? Cholesterol exceeds solubility, leading to cholesterol crystal formation. This is how cholesterol gallbladder stones are formed. Now coming to gallbladder hypomotility. So gallbladder helps in secretion of the bile by contraction. When gallbladder doesn't contract, there will be stasis of gallbladder. What happens? The bile will not be secreted out. The causes may be there may be prolonged fasting, that may be because of total parenteral nutrition, or in pregnancy, or in diabetes or vagal dysfunction. All these are the causes of gallbladder hypomotility, which leads to hyposecretion of the bile from gallbladder. Now, what happens? Bile sits for longer time in the gallbladder. More water is absorbed. Bile becomes thick. Now, all that bile, thickened bile, which again leads to cholesterol crystal aggregation and they grow. This leads to gallbladder stone formation. Now, coming to the third pathophysiology, how gallbladder stones are formed, it is nucleation and mucin hypersecretion. So, gallbladder has a epithelium, which secretes mucin glycoproteins. This mucin acts as a scaffold. Then cholesterol crystals adhere here, stone grows layer by layer. So these are the three things. One, hypercholesterol secretion or reduced bile salts or phospholipid formation. Second is gallbladder hypomotility. Third is nucleation and mucin hypersecretion. These are the three most important pathophysiology behind formation of gallbladder stones. Now, coming to types of gallstones, there are different types of gallstones. One is cholesterol stones, pigment stones. So, pigment stones include black and brown stones. So, what are there is a role of gut and microbiome as well in formation of gallbladder stones. Gut bacteria helps in it will helps in deconjugating bile acids. There are bile acids in the bile. It helps in deconjugation. After bile acid pool, it influences FXR and TGRF5 receptors. This helps in proper formation of bile and secretion of the bile. When there is disturbance, there will be because of dysbiosis, there will be altered bile composition. There will be increased lithogenic bile. There will be increased gallstone risk. Why? Because of dysbiosis. So this is why IBS, small intestinal bacterial overgrowth, non-alcoholic fatty liver disease, obesity often coexist with gallbladder stones. So bile acids as hormones. Bile acid regulates glucose metabolism, lipid metabolism, inflammation, gut motility as well. So disrupted bile signaling leads to insulin resistance, fatty liver, gallstones, and gut permeability also. So because of this gut permeability, there will be leakage of toxins from the gut leading to inflammation, and this inflammation will be systemic. Because of this, there will be acne formation. Because of this, there will be fatty liver. Because of this, there will be hormone disruption. So this clinical significance. So what is the clinical consequences of bile dysfunction? What happens if the dysfunction continues? There may be formation of gallstones, biliary colic. What is biliary colic? There is the on and off pain at the right hypochondrial region, acute or chronic cholecystitis, cholelithiasis, pancreatitis, fat malabsorption, dysbiosis, and fat soluble vitamin deficiency. All these are the clinical consequences of bile dysfunction. The core concept here is the most important thing here is gallstones form when cholesterol secretion exceeds the solubilizing capacity of bile salts. So when gallstones are formed, when cholesterol secretion exceeds the solubilizing capacity of bile salts. Bile salts helps in solubilizing the cholesterol. Whenever this capacity increases, the cholesterol formation increases, secretion increases, then bile salts will fail to solubilize the cholesterol crystals, leading to cholesterol gallstones. This is the most important pathophysiology here, combined with gallbladder stasis and mucin-mediated nucleation. Now, coming to the most important clinical features of gallbladder stones are so patient will be having nausea, vomiting, epigastric pain, right hypochondrial pain, biliary colic. The pain will be like colicky type of pain. These are the most important clinical features of gallstones. Whenever someone experiences this type of pain, and sometimes patient will be having left shoulder pain or right shoulder pain as well because of the irritation of diaphragm and phrenic nerve. This is called as referred pain to shoulder. So if someone has these symptoms, get an ultrasound abdomen and pelvis done. This is the investigation of choice for gallbladder stones. Now, if it is confirmed, the gallbladder stones is confirmed in the ultrasonography, then you reach your surgeon nearby who is experienced in laparoscopy, because the laparoscopic cholecystectomy surgery is the gold standard procedure for gallbladder stones. If you are asymptomatic, if you are young and the stone is small size, then there are no symptoms at all. You can wait and watch, repeat the ultrasound for every 6 months or 5 months. Then, if you are symptomatic, there is pain in the epigastric region or in the right hypochondrium or in the right shoulder or left shoulder, gaseous distension, nausea, vomiting, bloating type of symptoms, then get the surgery done, because it is a simple laparoscopic surgery with no major incisions. Simple half an hour to 1 hour procedure. You will be discharged on the same day or the next day. So nothing to worry about the procedure. This is a pathophysiology, clinical feature, investigation. Sometimes it may be ultrasonography. Sometimes we may use CECT abdomen and pelvis as well. So the procedure is gold standard, one and only one procedure, that is laparoscopic cholecystectomy. If you are old age and diabetic, definitely get it done. If you are diabetic, get it done. If you are diabetic and symptoms present, get it done. But don't neglect gallbladder stones, because the complications are horrible, like choledocholithiasis, pancreatitis, and intestinal obstruction sometimes because of the gall that we call as gallstone ileus. So all these are complications. So please, if someone is suffering from such type of problem or disease, you can visit me anytime. Dr. Raghuteja, laser and laparoscopic surgeon, Onus Robotic Hospital. So this is about today's webinar, decoding gallstones and surgery. Thank you. If you have any questions, you can ask me. If you have any such symptoms or problems, gallbladder stones, if you are suffering from, definitely you can reach me at Onus Robotic Hospital. Thank you.